In this video, you will learn how to tackle peripheral neuropathy head-on with these 5 natural supplements and start enjoying a life pain-free naturally. Do you feel overlooked by doctors who don't seem to understand your neuropathy? What if there are natural solutions they haven't mentioned yet? This video could be the answer you're looking for. You may have tried prescription drugs like gabapentin and Lyrica for your peripheral neuropathy, only to find they didn't work. Now, you might be looking into vitamins and other natural ways to find the relief you need. In this video, I'm not just going to share the top 5 natural supplements for neuropathy relief. You'll also find out how to stop wasting money on supplements that don't deliver. And I'll show you which nutrients you really need, how much to take, and why some need to be taken together for the best effect. I'll also give you my top 3 criteria you should always look for when looking for a supplement. You will learn how to pick the best supplements that really work, so you can shop smarter and make choices that genuinely benefit your health. I will also explain how your diet and supplements work together to help you heal. Supplements are exactly what their name suggests. It's a complement to a balanced and healthy diet. You can't just eat fast food and expect a bit of beet juice to reverse your neuropathy. The quality of both your diet and supplements is crucial. If you make the right dietary changes and add the correct supplements, you have the power not just to slow down the progression of this disease, but potentially to halt it altogether, laying the groundwork for healing and the reversal of symptoms. This is exactly why you need to watch until the end of this video, because I will also reveal the 5 keys to improving your diet and explain why jumping on the latest fad diet might seem helpful at first, but only offers temporary relief. I'll show you how small, manageable changes that can significantly affect your health over time and how to systematically build upon these changes for lasting impact. And I'll provide you with practical, easy to implement dietary adjustments. I'm not suggesting you overhaul your lifestyle overnight or become a meditating vegan by dawn. Instead, I'll share real, achievable ways to make simple changes that can profoundly influence your well-being. Hi, I'm Dr. Ole Olson, America's Neuropathy Coach. For almost 20 years, I've been helping patients deal with peripheral neuropathy. I've assisted thousands of patients and taught hundreds of doctors nationwide on how to manage this condition gently and effectively without the use of drugs or surgery. I founded Asuta Health, which has expanded to 5 clinics across the Midwest, specifically focusing on serving and treating individuals with peripheral neuropathy. I chose the name Asuta for its meaning to be healed, reflecting our deep commitment to healing those afflicted by this debilitating condition. Recognizing the difficulties in managing constant pain, the scarcity of widespread knowledge among healthcare providers, and the ongoing quest for effective treatments, this channel aims to bridge the gap. Our mission is clear: to offer hope and relief to everyone suffering from peripheral neuropathy. Now go ahead and smash that subscribe button if you're looking for breakthrough methods that can significantly reduce your neuropathy pain and improve your daily life. Let's embark on this journey to wellness together. There's a lot to unpack in this video, so let's dive in. First, we're going to talk about my top 5 supplements for peripheral neuropathy. The first one we're going to talk about is ALA, or alpha-lipoic acid. ALA helps improve circulation to nerves and can help repair damaged nerves. When supplementing, look for RALA. This is the naturally occurring form, and you want to take this on an empty stomach for best absorption. The research shows recommendations ranging from anywhere from 600 milligrams per day as the lowest effective dose, up to 2,400 milligrams per day. But on this higher end, there is potential for side effects, so you have to be cautious. The second supplement is vitamin B12. Vitamin B is found in meat, fish, milk, and eggs. Metformin, a commonly used medication for diabetes, actually depletes B12 levels. A long-term random controlled trial showed people with diabetic neuropathy and low B12 levels decreased diabetic neuropathy symptoms with supplementation of 1,000 micrograms of methylcobalamin. For best absorption, this should be taken on an empty stomach with water. The next supplement is acetyl L-carnitine. Acetyl L-carnitine is an amino acid found in red meat. A couple of random controlled trials showed that supplementing with 1,000 milligrams of acetyl L-carnitine 3 times per day improves symptoms of diabetic neuropathy. Acetyl L-carnitine is best absorbed with a small amount of carbohydrates, so it can be taken with half an apple or something similar. This can also interfere with certain medications, so be sure to talk to your doctor before beginning supplementation. The next supplement is magnesium. Magnesium is needed for proper nerve and muscle function. It also helps control blood sugar levels. The results are mixed, but it appears to help reduce symptoms, or at least help prevent it from worsening. Most studies looked at about 300 milligrams per day for magnesium. It's also a key nutrient that we're deficient in most people, so I'd highly recommend taking this supplement anyway. It should be taken with vitamin D and zinc for best absorption. And the last supplement is vitamin D. Lowered levels of vitamin D triggers inflammation in the body. and inflammation is a key trigger for neuropathy. The studies have been mixed, but since improved vitamin D levels improve overall health, we're going to go ahead and keep this one in here. Now, vitamin D is a fat-soluble vitamin, so you want to make sure that you are aware of what your current levels are and have them checked regularly by your doctor. You will want to ask your doctor for vitamin D 25-hydroxy to be checked. The normal levels for this is 3 to 100, while 50 to 80 is the optimal range you want to shoot for. If you're in a southern climate and get lots of exposure to the sun, you definitely want to get this checked before starting supplementation. But for those of you in my area, the Midwest, I'd recommend starting right away and then get tested in about 6 months. The baseline for the daily needs for what your requirement is about 35 IUs or international units per pound body weight. So for example, if you weigh 200 pounds, you're going to need about 7,000 IUs just to maintain your normal body function. If this is your range, I would start with closer to 10,000 IUs per day. As mentioned earlier, vitamin D is a fat-soluble vitamin, so it's best to take vitamin D with magnesium and a small amount of fat, either with a meal or, as I like to do, by adding in my fish oil supplements as well. Many patients have benefited from utilizing some form or combination of the above supplements I just talked about. I remember when Cheryl came to us. Cheryl had been dealing with severe burning in her legs. She couldn't seem to calm them down at all, especially in the evening when she was trying to sleep. She couldn't even allow the sheets to touch her feet. She was in such pain. After only about 6 weeks of supplementing with the nutrients we just discussed, she was almost sleeping through the night. She was feeling much better and had greater energy levels to get through her day-to-day functions. Now, people always ask, what do I look for when looking at a supplement? There are really 3 criteria I look for in any supplement. The first thing I look for is CGMP certified. This stands for Current Good Manufacturing Practices, which is an extensive requirement for over-the-counter dietary supplements by the FDA. The second thing I look for in supplements is that they are using the more naturally occurring form of the nutrient versus the more synthetic man-made versions, as the synthetic versions are harder for the body to recognize and utilize. So we want to use the most natural forms possible. And the third thing I look for is that the supplement has the right combination of nutrients and adequate amounts. Many supplements that I see, especially with neuropathy, are too low in terms of the amounts needed. Many supplements are based off of the RDA, or the recommended daily allowance values, which is determined by the FDA for the amount needed to reduce the risk of malnutrition diseases. An example of this is vitamin D. The RDA, the recommended daily allowance, is about 600 IUs per day. This has helped our population avoid rickets, but obviously does not get us anywhere near the amount that is needed for optimal health. Remember, all these recommendations are for people suffering with neuropathy to help facilitate healing. Supplements aren't designed to fix a poor diet though. They're designed to supplement a good diet. I've read studies showing that even with an all-organic, whole food diet, we are only getting about 40% of the nutrients that we did just 50 years ago. This is due to a number of factors, but something we need to be aware of. Eating processed and packaged foods that have been fortified is not getting us the nutrients we could get from a whole food diet. You probably hear a lot of different diets out there that should be followed. People tell you about paleo, about carnivore diet, about vegan diets. There's a lot of different diets, and everyone has an opinion on which one is the best. But most of these are just fads. If you really want to fix your diet and not fall into the trap of these fad diets, follow these 5 simple steps. Step 1, you want to eat mostly whole foods. Avoid all the prepackaged and processed things. Obviously, they've helped us in terms of convenience, but they really haven't done anything for our health. So you want to eat mostly whole foods in your diet. The second thing you want to do is avoid oils that are found in most prepackaged foods, like vegetable oils, canola oils, corn oil, sunflower, and safflower oils. These oils can become rancid and wreak havoc on hearts. Next is you want to make sure you get good healthy fats into your diet. I like to use things like avocados, avocado oil, olive oil, and coconut oil to get the best healthy fats into my diet. Fourth, you want to avoid sugars and artificial sweeteners. Both of these can wreak havoc on our health. You want to use natural sweeteners such as things like erythritol, stevia, and even monk fruit. The last one's pretty simple, but actually it seems to be hard for most people. We've got to drink more water. Most people drink lots of things like coffee, tea, soda, juices, things like that, but they rarely drink much water. We want to shoot for about half of our body weight in ounces, meaning if you weigh 200 pounds, you want to shoot for about 100 ounces of water per day and try to spread that out evenly throughout your day. These are the 5 keys to improving your diet. So hopefully this helps you. I hope this video was helpful and you learned something new about using supplements and changing your diet to help with peripheral neuropathy. Now it's your turn. What has been your experience with treating peripheral neuropathy? Did you start with medications or natural treatments? What has worked for you and what has not worked for you? Have you tried any of the above supplements for your peripheral neuropathy? What are some of your dietary challenges? Leave a comment below. If you learned something new today about supplements and dietary changes for peripheral neuropathy, do like and share this video so more people can also benefit from this information also. Be sure to subscribe to my channel to get more breakthrough methods that can significantly reduce your neuropathy pain and improve your daily life. The next video you should watch is this one right here. If you want to get my 3-step home care protocol for peripheral neuropathy pain relief, go ahead and watch this video next.